good evening. I hope and I believe all of you are doing well. Quick note whether the audio visual is all good. Am I audible and visible? A quick nod. I'm waiting for that nod here. All right, that's great. So, happy evening, everyone. Welcome to today's YouTube live session. That is a Pharmacology Binge Revision Part 2. We had Part 1 yesterday. So, if you have missed that, please watch that session. In the Part 1, what we had covered yesterday in Part 1, we had covered basically your CVS MACE, antiarrhythmics, anti-anginal drugs, and a part of CNS, antipsychotics, antiepileptics. That is what we had covered. All right. So now in the part 2 in the today's, I've already shared the PDF on the Telegram group. Our major focus is a few important points of antimicrobials. Then we have anti-cancer drugs, quick revision. And then we have the drugs and diabetes mellitus. These are the topics that we have to discuss today. Twinkle, I'm so sorry I have not included cephalosporins in this particular session. I'll do a separate video on that for classification of cephalosporins. So soon I'll post a video on that on how to remember. All right. Now, after this, we are also meeting at 7:30 p.m. as soon as this class gets over. After that, at 7:30 p.m., we have the NF100, that is NEET PG FMG top 100 topics. And we are having episode 57 today, right? And I'll be simplifying the topic of Darrow unit diagrams, okay? So we will be discussing Darrow unit diagrams. I'll tell you some easy tricks, very easy tricks on how to remember or how to solve the questions on Darrow unit diagrams. Some easy tricks on that. And then at 9 p.m., we will have the Unacademy Plus class of radiology revision. It is for the subscribers. That is what it would be. The plan for tomorrow, like we are having the KBMD episodes now at 12 p.m., right? Instead of 5 p.m. We are having the KBMD at 12 p.m. now. So 12 p.m. KBMD top 10 mnemonics. KBMD is Kaun Banega MD. That's a live quiz. Top 10 mnemonics is what we would have. Okay. Chalo, let's start with the revision. Before that, for whoever is new here, this is where we can stay connected. Instagram. Today we have posted the mnemonic for early pregnancy sign mnemonics, very easy mnemonics. This is where you are, and this is the Telegram group where we are following the revision timetable. And you can follow me on Unacademy as well for a lot of revision for the upcoming exams. All right. 2 KBMDs not materializing yet, Chakravarti. Maybe in the next 2-3 days, we will be having 2 KBMDs a day. Let me work on that. So on the timetable, I hope all of you are on it. It's 12th. The patho should be done by today. These are all your NF100 episodes that I have taken in relation to pathology. Next 3 days, please try and finish off medicine for the next 3 days. Okay, and these are the respective NF100 episodes where I've covered your renal tubular syndromes as well. Can't we get KBMD at 7? Anuja, it's a bit difficult. I'll see if I can do that. Okay, I'll update you on the Telegram group. Okay. All right, so let's start with antimicrobials. Few points here. Okay. Antimicrobials, very important. Which are the drugs which are used for MRSA, that is methicillin resistant Staphylococcus aureus, a very important and a frequently asked topic. For MRSA, what drugs are used? So for MRSA, basically remember it is Mr. Van Date Click is the trick to remember your MRSA drugs. That is Mr. Van Date Click. That is MRSA. are van, date, click. So Mr., like imagine a Mr. went in a van for a date and the date clicked for him. It clicked for him. So remember, MRSA is Mr. going in a van for a date and it clicked. So M for minocycline. Okay, M for minocycline, R for rifampicin. R for rifampicin. V, basically van is for vancomycin. You also have tilavancin, which has van in its spelling. So whatever has van, it is effective against MRSA. D for, what is D for? You have a daptomycin, right? It's daptomycin, that is your D. Then what do we have the next? You have T for tigecycline. Okay, DA is basically daptomycin. Then you have tigecycline. Your other tetracyclines like doxy can also be effective. Then the next one, C for cotrimoxazole. Okay, C for cotrimoxazole and even clindamycin. Then you have L for linezolid, very, very important. It is linezolid, right? Li is your linezolid. And then you have quinapristine, right? That is basically your streptogramins. Okay, your streptogramins, which are effective against MRSA, right? Against MRSA. Yes. What is the drug of choice for VRSA? What is the drug of choice for VRSA? The drug of choice for VRSA is daptomycin. Except, very, very important point for daptomycin, remember that daptomycin is not used in which infection? In pneumonia. Why? Because it is degraded by the pulmonary surfactant, so it cannot act in the lungs. Okay, except for pneumonia. For VRSA, it is daptomycin. All right. That is your mnemonic, Mr. Van Date Click. Let's have a look at this table. Have we covered all? Right click, you have clindamycin, daptomycin date, doxycycline, linezolid, minocycline, quinapristine, dalfopristin, tilavancin, tigecycline, cotrimoxazole, and vancomycin. Okay, so this is your list of drugs effective against MRSA. What will you use in a case where like daptomycin cannot be used, like in pneumonia? In that case, we will use linezolid, right? Linezolid would be used. Tell me the condition where vancomycin is used as an oral drug. What is the oral indication for vancomycin? For carriers, nasal carriers, yes, it's mupirocin. Okay. Vancomycin orally is given in which condition? Give me a minute. Yes, the oral indication for vancomycin is pseudomembranous colitis, which is caused by Clostridium difficile. Okay, which is caused by Clostridium difficile. Okay, let's go to next one. All of the following act by inhibiting the cell wall synthesis except which of the following? What is the answer to this? All of the following act by inhibiting cell wall synthesis except which of the following? It is clindamycin, right? It is clindamycin which does not act by cell wall synthesis, but it is by protein synthesis inhibitor. So which are the antimicrobials which are cell wall synthesis inhibitor? We have a mnemonic for that. So imagine a beta, right? Beta is always demanding, wants something or the else from the father. So here you have the father who's wondering now what the beta has come to ask for. So you have the beta who first asks to the dad that I want a cycle. Then once the cycle is, he gets a cycle. Next is, now I want a van. Van, I'm bored of van now. The next thing I want is a fancy car, that is Ford. And then I want a huge gari, a huge vehicle, that is bus. So basically the mnemonic here is beta, that is beta lactams, cycle, cycloserine, van, vancomycin, Ford is phosphomycin, and bus is bacitracin. So basically, it is your beta-lactams, it is cycloserine, vancomycin, phosphomycin, and bacitracin. These are your cell wall synthesis inhibitors. In your beta-lactams, we have your penicillin, cephalosporin, right? The imipenems, carbapenems, all of that. Lactams coming in your beta-lactams. All right. So yes, cycle, when, Ford, and bus is what we need to remember. So going back to the question that we had, so vancomycin, ceftriaxone basically is a beta-lactam and a cycloserine. So clindamycin is your protein synthesis inhibitor. Okay, it's your protein synthesis inhibitor. Next one, coming to your which drug, this is a recently asked question, which drug acts where in the cell wall synthesis pathway? Right, where does a penicillin act? Where does your vancomycin act? We'll be seeing that as well. Okay. Now coming to this one. So antimicrobials which act by cell wall synthesis inhibition, beta-lactams, bacitracin, glycopeptide, right? It's your glycopeptide which is vancomycin. Okay, which is vancomycin. Protein synthesis inhibition is by 30S and 50S inhibitors. So the mnemonic for that is bi at 30 and cells at 50. Bi at 30. A and T is 30. Aminoglycosides, tetracycline, tigacycline is 30S. Cells is your chloramphenicol, erythromycin, that is macrolides. Then you have linezolid, your lincosamide, that is clindamycin, and streptogramins. These are at 50S. Remember S for streptogramin, not streptomycin. Streptomycin is an aminoglycoside. Remember that at 30, aminoglycoside tetracycline is 30. Rest is on 50. Membrane integrity. Which one act on the cytoplasmic membrane, not the cell wall? Cell wall is bahar wala, membrane andar wala. So polymyxin and your daptomycin. So PM and your PM, polymyxin, daptomycin, that's your plasma membrane. That is the plasma membrane. PM, daptomycin acts on the cell membrane. Polymyxin acts on the cell membrane. Nucleic acid synthesis, fluoroquinolone. Remember A, B, C, D, E, F, G. Okay, yes, Anuja, I'll be discussing antifungals. G is your gyrase. It acts on your DNA gyrase. Metronidazole, DNA, DN, it acts on your DNA. Rifamycins, R for R, basically RNA polymerase is where they act, right? Metabolic pathways, folate wala is your sulfonamide. Remember, sulfonamide is your folate. It is like PABA. It inhibits your folate. And you have trimethoprim, like your methotrexate, which acts on folate. You have trimethoprim. Okay, so these are the various mechanism of actions of your antimicrobials. Minocycline, yes, is vestibulotoxic. You can remember it as Meniere's disease, minocycline. Meniere's affects your vestibule, right? The inner ear. It is vestibulotoxic. Okay, a quick thumbs up, everyone, if you are clear with the tricks to remember your mechanism of action of the various antimicrobials. Right, a quick thumbs up, everyone, if you are with me. So we have seen the cell wall, we have seen the cell membrane, we have seen the nucleic acid, metabolic pathway, folate wala, and we have seen the protein synthesis. Amazing, that's great. All right, let's go to the next one. Now remember that these cell wall synthesis inhibitor drugs, these are, okay, these are your cidal drugs. Okay, these are bactericidal. Okay, these are bactericidal. So easy trick, if you have the cell wall synthesis inhibitors, these are cidal. The protein synthesis inhibiting drugs, they are static, except remember your aminoglycosides and streptogramins. Aminoglycosides at 30S, streptogramins is at 50S. Nucleic acid wala Fluoroquinolone gyrase required for your DNA. Metronidazole DNA, rifamycin is RNA polymerase. So this is related to your DNA and RNA. Okay. All right. So remember, aminoglycosides, streptogramins are the only ones which are protein synthesis inhibiting drugs, and they are cidal. The rest of them are static. A very important point for aminoglycosides that I want you to remember is aminoglycosides, no activity against anaerobes. Remember, activity no against anaerobes. Very, very important. They are not effective against anaerobes because they require oxygen for their activation. So without oxygen, they will not be effective at all. A very important question. What is the drug of choice for anaerobes that we use? Above the diaphragm and below the diaphragm. What is the drug that we use? Above the diaphragm, like lung abscess, it is clindamycin. It is clindamycin above the diaphragm. Below the diaphragm, it is metronidazole. Okay, metronidazole below the diaphragm. Okay. All right. Next one. This is your protein synthesis inhibitor drugs. So you have 30S by at 30 aminoglycosides, all your mycins, and then you have tetracycline and even tigecycline. Here 50S, you have cells, that is cells at 50. Okay, by at 30, and then it is cells at 50. Give me a minute. Right. It is cells at 50. Chloramphenicol, erythromycin, linezolid, lincosamide, clindamycin, and streptogramins. Remember that linezolid, very, very important and a frequently asked question, that linezolid inhibits your initiation complex formation. It acts on the 28S subunit of the 50S subunit of ribosome. By acting on 28S, 50S ka 28S pe, it inhibits your initiation complex formation. Okay. So look at this one. Your tetracyclines act at 30S. Okay. You have 30S and you have 50S. Okay. The tetracyclines act at the 30S. Your A site tRNA binding is affected. This is tetracycline. Chloramphenicol is your peptidyl transferase which is affected. Macrolides, clindamycin 50S. Okay, this is what we have already seen. This is your linezolid, which is inhibiting your initiation complex formation by acting at 50S. In the cell wall synthesis inhibition, the drugs that I was telling you, that at each step, which drug is acting? Which is the drug which acts on cell wall synthesis by inhibiting your transpeptidase, by inhibiting your transglycosylase, which inhibits the alanine racemase. This is also what we need to know in basically the mechanism of action of the antimicrobials acting on the cell walls. Okay. So which is the first one? Enol pyruvate transferase. E के बाद आता है F. Remember, it is phosphomycin. Transpeptidase, it is basically your cross-linking, which is affected by penicillin. The beta lactams, that is the penicillin. Remember, penicillin is your transpeptidase. Dephosphorylation of bactoprenol, BAC, that is your bacitracin. Okay, that's your bacitracin. Alanine racemase and ligase. Alanine racemase is like racemase cycle, ALA. If you read it aage, you read it piche ALA. It's like a cyclic word, ALA. So it is your cycle wala, that is cycloserine. Transglycosylase is your glycopeptide, which is vancomycin. Okay, it's your vancomycin, which is basically, it causes the chain elongation that is affected by vancomycin. This has been asked in one of the recent exams. Okay, so it's very, very important. Vancomycin acts by transglycosylase inhibition, and that is how it inhibits the chain elongation. Okay, the chain elongation. So look at this one. So you have your enol pyruvate transferase, that is your phosphomycin. Bactoprenol, you have bacitracin. Alanine racemase and ligase. Alanine is cycloserine. Chain elongation transglycosylase is vancomycin. Cross-linking transpeptidase is beta-lactams. This is very, very important. Okay, this is very, very important. Next one, antibiotics. This is an important question. Which is an antibiotic which has time-dependent killing, but it has no or minimal post-antibiotic effect. Which is the one which has minimum post-antibiotic effect? It's a time-dependent killing. So basically, your antimicrobials can have concentration-dependent killing or they can have time-dependent killing. Concentration dependent means they will kill the organism if the concentration is about a particular level. Time dependent means it is the duration for which the drug is present which is important. Remember, the ones which have time dependent killing with minimal or no post antibiotic effect is your beta lactams and vancomycin. Absolutely remember, that's your BV. BV matlab in Hindi, BV matlab wife. So a wife, basically, as the duration of the marriage increases, right? In the first year, the number of fights with the husband would be less. Second year, more. Third year, still more. So it goes on increasing. So basically, it is dependent on the time, right? The killing, the fights are dependent on the time. But you know that the fights between the husband and wife are generally the ones which have no like hangovers. सुबह झगड़ा हुआ while the husband is going for work, शाम को आए, everything is normal. There is minimal or no post antibiotic effect. Okay, that is how you can remember that BV is your time dependent killing. As older the marriage gets, then you have more fights, but there is no post antibiotic effect, right? There is no hangovers. There is no, the grudges which are carried forward. Okay? What happened to the live chat? Okay. All right, so that's your BV, time dependent with no post antibiotic effect. Next one, we have already seen this, acts by inhibiting DNA gyrase, F and G. It's your fluoroquinolone, which is your ciprofloxacin. Fluoroquinolone, which is your ciprofloxacin, which is your DNA gyrase. All right. Which one causes red man syndrome? Which antimicrobial causes red man syndrome? Remember, man is van. It is vancomycin which causes red man syndrome. Why does it cause the red man syndrome? It is because of the histamine release. Okay, it is because of the histamine release. So how do we prevent this? This is prevented by giving the slow IV infusion. Okay, so the prevention is by the slow IV infusion, that is for vancomycin. Okay, how did we say vancomycin acts? It's your cell wall synthesis inhibitor. It acts at the step of transglycosylase, which is basically the step of chain elongation. Okay, chain elongation. And which drug causes gray baby syndrome? One is red man. Which one causes gray baby syndrome? Gray baby, remember G, आज के हमारे pregnancy वाले में भी है C, looks like G, right? Your Goodell, that's your cervix. G is like C, that is your chloramphenicol. Okay, that's your chloramphenicol which causes your gray baby. Which are the other color wale side effects that we know? Which one causes the blue pigmentation of the skin? Your recent INICET question. Antiarrhythmic. Remember, it's your amiodarone. Amiodarone, antiarrhythmic. What are the side effects with amiodarone? What are the side effects that we see with amiodarone? It causes your lung fibrosis, pulmonary fibrosis, very, very important. It also causes your photosensitivity. Iodine, iodine, it affects the thyroid function as well. Okay. So there are multiple side effects that you see with amiodarone. Right. Amiodarone, cornea pe bhi deposits hote hain. It causes your corneal deposits as well. Next one, which drug, the CVS drug that you read, it causes xanthopsia. Xanthopsia, yellow vision. Xantho means yellow. Which one causes xanthopsia? Xanthopsia is seen with digoxin, right? Digoxin. How does the digoxin toxicity present? It's your GI manifestations. It looks like your gastroenteritis. There is nausea, vomiting. But after that, then there is xanthopsia. Also, there is yellow vision as well. Okay, there's yellow vision as well. Okay. Next one. Just a quick one-liner here. Ritonavir's boosting effect is not seen with which of the following? Ritonavir's boosting effect is not seen with no elevation with nelfinavir. Okay, remember it is your nelfinavir. Nelfinavir, no elevation. If you combine it with your sacunovir, indinavir, lopinavir, it increases their levels. Why? Because basically ritonavir is cytochrome P inhibitor. It inhibits your metabolism of other drugs. Nelfinavir, there is no elevation. Okay, there's no elevation. Next one, what is the side effect with bedaquiline? Where do we use this bedaquiline? Bedaquiline is used in TB. Okay, how does it act? ATP synthase inhibition. Bedaquiline, remember Q, it is basically your QT prolongation is an important side effect that we need to remember with bedaquiline. Okay, QT prolongation. Next one, what is the mechanism of action of various drug resistance? Which antimicrobial? What is the mechanism of drug resistance? A very, very important question. So here we need to remember that enzymatic breakdown. Enzymatic breakdown, remember as breakdown is like break dance. जो हमारा movie आया था break dance वाला, it is A, B, C, D. That is your aminoglycosides, beta lactams, chloramphenicol. D for degradation. Okay, D for degradation. So you have aminoglycosides, beta lactams, chloramphenicol, enzymatic breakdown. Decreased permeability, not allowing the drug to go in. Ana, under ana is not allowed. So basically it's your aminoglycoside. The under ana, it's your aminoglycoside, which is decreased permeability. Efflux pumps, remember this pump, which is the tetra pump. You have the aquarium air pump, which is the tetra. The name basically you can see it's a tetra, which is the pump. So remember, efflux pump is your tetracycline. Metabolic pathway, we know in metabolic pathway you have folate, so it's your sulfonamides. Altered target, very, very important. What is the mechanism of resistance? MRSA. It is your altered penicillin binding protein. To where the penicillin binding protein that is altered in your MRSA. Same as with vancomycin, also with fluoroquinolones. Okay. So basically you have your various mechanisms, enzymatic breakdown, ABCD, permeability, ANA, JANA, that's basically your aminoglycoside. Pump is your tetra pump, metabolic is sulfonamide. MRSA is your penicillin binding protein, the altered target. Okay, altered target. So look at this. What is the mechanism of action? Which drug? Target site modification. It's basically your MRSA, PBP. Decreased permeability, ANA, JANA, aminoglycosides. Efflux is your tetra pump. Then you have the enzymatic degradation, enzymatic breakdown, ABCD. Okay, that's your ABCD. Okay, so this is the drug resistance mechanism. Okay, this is your drug resistance mechanism. So everybody, quick thumbs up again, so that I know that all of you are with me here. Yes, so you have tetra pump, ABCD, ANA, JANA, and you have the PBP that you need to remember for MRSA. All right, let's go to the next topic here. That is great. Next one, which is the antifungals mechanism of action. Very, very important. The mechanism of action for bypass, basically it's your metabolic pathway. Bypass wala is the metabolic pathway, that is sulfonamides. Okay, sulfonamides. Coming to the antifungals, what is the mechanism of action of the various antifungals, right? So in the antifungals, Basically, you have the cell wall and you have the cell membrane bilayer, which has ergosterol, right? Ergosterol is present in the fungus. You have your beta glucan, which is present in the fungus again. Okay? The class, yes, Narvada, it's a bit fast because we are doing the rapid revision, the binge revision. Okay? All right. Yes. So what were we talking about? Which antifungal acts by inhibiting your DNA RNA synthesis? So remember, for DNA RNA synthesis, basically we require your purines and pyrimidines, right? We require purines and pyrimidines. Which are the purines? Remember, egg puree, someone eating egg puree, adenine, guanine, and pyrimidines are your cut. So your cytosine is the one which is a pyrimidine. So flucytosine is the one which is basically acting by inhibiting the nucleic acid synthesis. Flucytosine. Okay, flucytosine. Next one, coming to your ergosterol synthesis. So you have squalene to squalene epoxide. Then you have lanosterol to ergosterol. So remember that when you say alphabetically P, Q, R, S, T. S and T. So squalene पे act करने वाला is terbinafine. So ST squalene पे act करने वाला is terbinafine. Lanosterol to ergosterol, that is your azole, that is OLE, that is your azoles. Azoles act on by conversion from lanosterol to ergosterol. Right, this is done with ergosterol. Coming to the next one, that is amphotericin B. Remember, ampho is like your ampo. It creates pores in the cell membrane, right? It is your cidal antifungal drug. Amphotericin B is cidal, right? It's nephrotoxic also, remember. So ampo is creating the pores, right? You can see. And that is how the fungus is killed. All the contents coming out. So remember, amphotericin B is acting on your cell membrane. Next one, glucan synthesis, echinocandins. Candins are your glucan synthesis inhibition drugs, right? Like your micafungin. So those are your glucans. So beta glucan synthase inhibition is by your echinocandins. Okay, it's your echinocandin. Again, look at this one. So inhibiting the ergosterol synthesis, you have squalene to squalene epoxide, then you have your lanosterol and ergosterol. Here you have your terbinafine, which is squalene epoxidase inhibitor. Here you have your azoles, right? Imidazoles, triazoles, lanosterol to ergosterol. Then you have your very important mitotic spindle pe act karne wala is griseofulvin. On the spindle you have griseofulvin. Remember, important drug interaction, disulfiram reaction with griseofulvin. DNA synthesis, flucytosine. Plasma membrane, amphotericin B, that is your polyene. Cell wall, which contains the glucan, is your echinocandin. Okay, it's your echinocandin. Hyphal distortion, tall naftate. Tall naftate मतलब तोड़ देता है hyphae. Hyphal distortion, that is your tall naftate. Okay, that's your tall naftate, which is your hyphal distortion. Okay. So that was about your quick review of the antifungal drugs. Main, you need to remember your DNA RNA synthesis, basically nucleic acid synthesis. Then your ergosterol, the squalene and the lanosterol ergosterol. And then you have your plasma membrane, amphotericin B, the cell wall, which is the echinocandins, beta glucan synthesis, and you have griseofulvin, which acts on the spindles, Remember, griseofulvin is like grease. Grease matlab fat. When you take it with the fatty meals, the absorption increases for griseofulvin. Disulfiram reaction is again with your griseofulvin. Okay, disulfiram reaction. Okay, let's go to the next topic now. That is anti-cancer drugs. Okay, starting with the anti-cancer drugs, a quick review of that. What is the mechanism of action of the various anti-cancer drugs? So you have alkylating agents, you have your anti-metabolites, you have your antibiotics, you have your, the topoisomerase inhibitors, बहुत सारे हैं. So from the name itself, you can remember 6-mercaptopurine. It's your purine. So inhibiting the purine. Thioguanine. Purine is your adenine guanine. So it is again your purine which it is inhibiting. So from the purines and pyrimidines, first you have ribonucleotide, then you have deoxyribonucleotide. So hydroxyurea is a drug which acts by inhibiting your ribonucleotide reductase. Okay, it's your ribonucleotide reductase. Then you have your methotrexate, very, very important. Methotrexate inhibits your dihydrofolate reductase, right? It's an anti-metabolite, all anti-metabolite inhibiting the synthesis S-phase specific. 5-fluorouracil, it is U and T going together alphabetically. It's your DTMP synthesis which is inhibited by both methotrexate also and 5-fluorouracil also. Cytarabine, again your pyrimidine cut. It's your DNA synthesis inhibition. Bleomycin, it is your antibiotic. Anthracyclines acting on basically the DNA. Alkylating agents, nitrosoureas, they cause cross-linking of DNA. L-asparginase, remember it's aspargine, like your amino acid, which is required for proteins. So it inhibits the protein synthesis. Which one acts on the microtubule? Microtubule M. It acts on the M phase. You have vinca alkaloids and you have taxanes. Okay, vinca alkaloids and taxanes. So vinca alkaloids, they act by inhibiting the spindle polymerization. Taxanes like paclitaxel, remember it is P and P. It promotes your polymerization. It inhibits the polymerization, vinca. This promotes your polymerization. Okay. So this is a quick mechanism of action. Look at the cell cycle phase. Very, very important question. Vinca and taxanes. We just now said they act on the microtubules, the spindles. Mitosis, it acts on the M phase. Right. They are on the M phase. Which one are on the S phase? Your anti-metabolites, your purines, pyrimidines, methotrexate wale, those are your S phase. Okay, that is how you'll identify. G2 phase, very, very important, bleomycin. B for the second alphabet, it acts on the G2. Which anti-cancer, anti-tumor, antibiotic is cell cycle specific? Bleomycin. Rest of them are non-specific. Your alkylating agents are cell cycle non-specific. They can act at any phase. Dividing also, resting also. Okay. All right. Now a quick one on your plant sources. If you get image-based question like this and you are asked which anti-cancer drug is derived from these plants, how will you identify the plants? Okay. So in this image, first one, look at this. This is very, very important where you see this violet color flower. This is like your periwinkle. That is your catharanthus. That is your vincristine and vinblastine. Remember vinca alkaloids. Vinca is from catharanthus. And VI is your violet color flowers is what you would see for catharanthus. Remember, catharanthus is your vinca alkaloids. The next one that you have is your taxanes, taxol, docetaxel, paclitaxel. It is from taxus. Again, remember, taxus is basically your U bark from where we get the taxanes. Camptotheca acuminata, theca, that is your thecans, right? Topothecan, irinothecan. It is from Camptotheca acuminata. Like you have condyloma, the acuminator, the warts, those are there. This plant looks like these projections. These are like the warty projections. So remember, this is acuminata, Camptotheca, giving the thecans. Next one is your podophyllum. Podophyllum, which gives your etoposide. The etoposide, epipodophylltoxin. This one looks like the podo, that is the feet. Okay, the flower basically has this feet-like of petals. That is your podophyllum. Remember, vinca is violet color. It is your vinca is catharanthus. Then you have your taxanes, alphabetically Y, it's the U bark. Then you have the etoposide, which is your podophyllum, which is the feet-like. And then you have your acuminata camptotheca, that gives the thecans. Okay, that gives the thecans. Plant name diya hoga, of course diya hoga. It's not your subjective paper, it's your MCQ paper. You just need to identify, if at all you're given that plant ka image, which anti-cancer drug is derived from this plant. Either it would be the name given or it would be the image given. Okay, all right. 2 points on your anti-cancer. UGT1A1 activity is very, very important to be tested for which anti-cancer drug. If you don't have UGT1A1 activity, which drug is contraindicated? This is a frequently asked question. Which drug is contraindicated if we do not have the UGT1A1 activity? It is irinotecan. Okay, it's your irinotecan, because UDP, glucuronil transferase, which is basically absent in your Crigler-Najjar syndrome type 1. Irinotecan is metabolized by UGT1A1. So if that enzyme is not there, there will be toxicity. So in Crigler-Najjar type 1, it is contraindicated. Where do we use this irinotecan? It is used in colorectal cancer. What is the side effect? The side effect is also the GI side effect. That is, it causes diarrhea. The dose limiting side effect is diarrhea. DPYD gene, very, very important, needs to be tested for 5-fluorouracil. Okay, it is for 5-fluorouracil where you need to check for DPYD gene activity for your 5-fluorouracil. Next one, thymidine less death, the DTMP synthesis, that is basically inhibited by 5-fluorouracil T and U. So which anti-cancer causes thymidine less death? That is your 5-fluorouracil. Folfiri regimen, right? You have read about folinic acid. Folinic acid is used along with methotrexate to reduce its toxicity. Also remember, it is also used along with 5-fluorouracil. It's not only methotrexate but also with 5-fluorouracil. Like you have folfiri regimen. What is folfiri? Folinic acid, you have 5-fluorouracil, and you have irinotecan. This is used in CA colon. Remember that folinic acid is used with 5-fluorouracil also. Next one, some important side effects of the anti-cancer drugs. Okay, which anti-cancer drugs causes adrenal insufficiency? Which anti-cancer drug causes adrenal insufficiency? Adrenal sufficiency नहीं चाहिए, adrenal insufficiency करता है ये. So it tells the adrenal bus करो, we do not want more adrenal hormones. It is your busulfan. Okay, it's your busulfan, right, Anisha? We have Folfox as well. Busulfan is your bus karo adrenal, so it stops the adrenal. Okay, that's your busulfan. Busulfan also causes your pulmonary fibrosis. Remember, for pulmonary fibrosis, BB, busulfan and bleomycin. Okay, busulfan and bleomycin. Disulfiram reaction, your MAO inhibition activity, most leukemogenic. All of this is basically your procarbazine, right? So procarbazine is, remember, like disulfiram. Ram is a person who is very pro at driving a car. It's your procarbazine, right? So MAO, you can say that wow. MAO is like wow. So you say wow. Ram is very pro at driving a car and it is most leukemogenic. Okay, remember, most leukemogenic, it's your procarbazine. Pancreatitis hypercoagulability, it is your L-asparginase. Okay, it's your L-asparginase. Remember, P, it is pancreatitis is what it is causing. Hypercoagulability, it is also your L-asparginase. Hyperglycemia, affecting the pancreas, insulin affected. Remember, it's causing your hyperglycemia also. Prolonged neutropenia is a side effect with कार मस्टीन, आपने अगर एक मस्त वाली कार देखी, कार मस्त वाली देखी, it has a lot of like hangover, right? कि it is there in your mind, it runs in your mind for a long time. So it's a prolonged effect. Remember, car mustine is your prolonged neutropenia. It's a nitrogen mustard. Hand-foot syndrome. Remember hand-foot, write your foot as FUT. It is 5-fluorouracil. Okay, it's your 5-fluorouracil, or it's drug that is capecitabine. Capecitabine. So remember, for your hand-foot, you have the foot that is 5-fluorouracil, and you have the cap that is capecitabine. So the two ends, the head that is the cap and the foot. Flagellate dermatitis is like the blue marks on the skin. The blue marks, that is blue, is your bleomycin. Okay, it's your bleomycin. Most emetogenic, that is cisplatin. You can remember cisplatin for vomiting, the CTZ zone in the medulla area where it acts. It causes your vomiting. It is nephrotoxic also. It is ototoxic as well. Right, it's ototoxic, it's nephrotoxic, most emetogenic, that is your cisplatin. Okay, these are the most important side effects that you need to remember with the anti-cancer drugs. Very, very important. All right, some new drugs that you need to know. Exabepilone. For which cancer do we use exabepilone? Remember BE, that is for your breast cancer. Meclorethamine, it is used for as a cutaneous one. Where is meclorethamine used? Where do we use cutaneous meclorethamine? What happened to the live chat again? Just give me a minute, guys. Let me see the live chat. Right. Meclorethamine, right. It is your cutaneous, it is used in your cutaneous T-cell lymphoma, like mycosis fungoides, M for M. So this is cutaneous mycosis. It is Meclor is your mycosis cutaneous. Pemetrexate, it's like your methotrexate, pemetrexate. ME, remember this is used for mesothelioma. Okay, it's used for mesothelioma. And pralatrexate, is it used for peripheral B cell lymphoma or peripheral T cell lymphoma? Where is pralatrexate used? Remember, it is your peripheral PR and it is your lymphoma T cell. It's your peripheral T cell, not your B cell. Okay. So this is basically exabepilone is breast cancer, meclorethamine gel, that is mycosis fungoides, pemetrexate mesothelioma, pralatrexate is your peripheral T cell lymphoma, not your B cell lymphoma. All right. So yes, that was a quick review of your anti-cancer drugs. We have seen the mechanism of action. We have also seen your which cell cycle, what drug is acting, and few important side effects that you need to know for the anti-cancer drugs. I've taken this in detail on the Unacademy Plus as well. So what we'll do for now is we will stop here. The next last part of the session for today that I had planned, that's your diabetes mellitus drugs. I'll do that tomorrow in the NF100 episode. Okay, so today we have the NF100 because 7:30 we have the next class on the Unacademy YouTube channel where I'll be discussing the Darrow unit diagrams. It's your episode 57 of NF100. This I will do tomorrow as episode 58, the diabetes mellitus drugs. We'll do that tomorrow. All right. And for everyone, a reminder, we are starting with your new subject, right? The timetable that you have. From tomorrow, you have 3 days ka target, and that is to complete medicine. Okay, that is to complete medicine. Thank you so much, everyone, for joining in. I hope this has helped you in the quick revision. And we'll have more such sessions coming in. When are we meeting tomorrow? Tomorrow we are meeting at 12 p.m. for KBMD on the Unacademy app. It's a free live class. If you are asked for a code, you can use the code Dr. Nikita for joining the free live classes. All right. Yes, annotated PDF I'll be sending right away on the Telegram group. Antiretroviral covered on the plus. I'm not done yet. I'll do it in one of the upcoming sessions. Aishwarya, take a break if you want, but please don't break down. All right. Anything else? Antiretrovirals, I'll do that soon. How to complete a medicine in the next 3 days. So whoever is, if you're planning, you're following the timetable medicine in the next 3 days, basically what you need to do is start your day with the PYQs. First finish off all the PYQs of 3 years of NEET PG, INICET and including FMGE. In तीनों साल के पहले PYQs कर लो. Whichever you are confused, what you should do is solve the PYQ and then try to do the active recall of the entire topic that has been asked. Let's say there's a question on HOCM. Try to ask yourself questions on HOCM, what all can be asked and whether you know everything about it. If yes, go to the next question. If not, quickly revise the topic of HOCM. So your first focus has to be on the PYQs and the related topics. First, try to do that. Very, very important. And after that, then the recent whatever grant test you have given so far, उसमें मेडिसिन के जो भी क्वेश्चंस होंगे वो एक बार क्विकली रिव्यू कर लो. Okay, then review the medicine questions from all the grant tests that you have given so far. Then review the bookmarked questions that you have. Revise your weak topics in medicine. There might be a particular system that you might feel I'm not very confident about. Revise only that. Please don't keep revising everything in the last days. It's absolutely not possible. All right. Okay. So that was about it. And episode 55 should be there, I believe. I'll give you for the next 3 days for medicine. I'll give you the systems. If you are planning to do it like system wise, I would suggest go PYQs. In that case, your system will not be done. But if you're doing custom module sort of thing where you're putting the system and you're putting the PYQs, you want to do system wise, I'll give you the targets for the 3 days for medicine. Okay? Yes, Reshma, hopefully we'll have the study with me session tomorrow 7:30 a.m. provided I sleep early today. Yesterday, like I slept at 2:30 and that's the reason could not wake up early. So I'll try and do it tomorrow, like resume from tomorrow. Okay, NF100 is now at 7:30 p.m. at Unacademy YouTube channel. Tomorrow also it will be there on Unacademy YouTube channel, the diabetes mellitus drugs. Okay? Thank you so much, Dogt. So thank you so much, everyone. See you in the next half an hour. Till then, goodbye, take care, and keep studying.